going to go ahead and get started today on our workshop, Strengthening LGBTQ plus Inclusion and Dental Education. AIDPH is very excited to be hosting this workshop jointly with the American Dental Education Association. No presenters have any conflicts of interest today. And CEUs are available for this workshop. And so I'd like to first turn it over to Dr. Tita Gray to provide words of welcome from IDEA.
Hi, good afternoon, everyone. Sometimes I swear to God, when I get up and start working at 5:36, so it seems like morning is an extension. I just want to say good morning all the time. But thank you, American Institute of Dental Public Health, for having me today. And on behalf of IDEA, just want to wish a warm welcome to everyone. So I didn't present, I don't have any slides or anything. I just really wanted to kind of give my own little quick testimony about why I feel the topic today is so vastly important. So I'm the Senior Vice President of Access, Diversity, and Inclusion at IDEA. I have been a professor, I've been an assistant dean, I'm an author, and I've done a TED Talk. Now I'm saying these things because what people normally see is they see a woman, they see a Black person, assumption that I might be gay, and I am. And if I were wearing a beanie, they would see somebody whose faith is Muslim. Unfortunately, most of the time I'm judged and there is bias based on those last characteristics that you heard, but yet they are what I bring with me no matter where I go. I'm a woman, I'm Black, I'm gay, I'm Muslim. That is who I am no matter where I am. All of the rest are things that I've accomplished and worked really hard for. And I want to preface that because when we start developing a humanistic environment, society, practices, when we teach those to our students, when we embed those, then people can appreciate all of who we are, everything that we come with, whether it's school, whether it's going to the dentist's office. And we had IDEA, we did our tapestry table workshop with Dominique Jackson from the show Pose. And she talked about her experience going to the dentist and how her teeth were really, really bad at one point. And she said, you know, not only being a trans woman was one thing that she was dealing with, but also it was really hard to get work and just feel a sense of belonging because she needed to have dental work done. And she felt so afraid of being judged for just healthcare that it took her a while to find somebody that could really, that would really help her. But when she did, and when she got her teeth taken care of, it made all the difference in the world. I totally understand that feeling of wondering if you are going to be welcome, if you are going to be treated with fairness when you are a patient. I've had my own situations with dental care, which at one point almost stopped me from going to the dentist, I would say for like 3 to 4 years. It was traumatic. It was straight bias. The dental student that I was working with felt that Black people could handle pain easier. So did not give me the level of pain medication that I should have had to get this major surgery done. And I cannot tell you how that affected me moving forward in my life. So all I want to say is today, this discussion, although it is tailored towards my LGBTQ plus folks, of which is my community, I think it's just very important that we really take the time to see each other as humans. Right now in healthcare, there is a lot of doubt and distrust, period, due to COVID, due to anti-racism, things that we've been seeing going on. And we really need to flip the script, because at the end of the day, we are the ones, and not me, I'm not a dentist, but I still need to go to dentists. I still need to help other dentists in this access, diversity, and inclusion area. So I take it very serious. And I think that together we can build a better society, we can build better healthcare, and definitely learn to treat each other with the level of respect and dignity that we all deserve. So I just, again, want to say thank you to the American Institute of Dental Public Health. What you're doing today is extremely important. And if there's any way in which I can provide additional support, I'm always here. And also, too, I wanted to just please make sure that you, if there's any students on, that they join our Adia Pride section, which is open for membership, and we always need great leaders to come on board. So thank you today. Have a wonderful time. I'm going to stay for a few more minutes because I want to hear Dan and Marita, who are my family. So I'm looking forward to spending some time with you all. Thank you so much. Have a great evening.
Thank you so much, Dr. Gray. We appreciate those words of welcome. And on behalf of AIDPH, I certainly echo those sentiments. At AIDPH, one of our strategic initiatives for this year was to expand our LGBTQ plus focus. And so the way that we've done that, one way of many, has been to increase the number of workshops and educational experiences that we've been able to offer. And so we appreciate this partnership with Adia, and really couldn't have said anything more important than what Dr. Gray just shared. So these are the three focuses of the workshop: evaluating the current dental school curricula regarding LGBTQIA plus patients, examining dental education environments, and identifying opportunities to improve LGBTQIA plus inclusion. And so without further ado, we will move into the panel part of today with our three panelists. And so I'm just going to ask them one by one to introduce themselves. And I'll start first with Scott Howell, and we'll just use first names for the discussion today. You can see each panelist's full bio at the AIDPH website on this event. So Scott, would you like to introduce yourself to the group today?
Absolutely. And Annalise, yes, I am a first name kind of person, so I love it. Good morning or afternoon, depending where you're at. I'm in Arizona, and I am the Director of Public Health Dentistry and Teledentistry at A.T. Still University, Arizona School of Dentistry and Oral Health. I came out when I was 14, I believe. I think my bio may say 15, but it was around that time. Told my mom when I was 15. And I've been working recently on a small pilot project in the areas of LGBTQ plus education and in higher education, specifically within medical and dental schools. And it's a pleasure to be here with everyone today. And I look forward to the panel discussion and the breakouts. Nice to meet you all.
Thanks so much, Scott. Dan, would you like to introduce yourself?
Definitely. Hello, everyone. It's nice to see you all over this virtual format. My name's Dan. I use they, them pronouns. I'm a queer person. I'm a non-binary person. I'm the child of an immigrant from the Philippines. I am a recently graduated dentist from the University of Washington, graduated during the pandemic in June. Also wanted to say hi to Dr. Gray, my family. And I think if you read my bio, you'll know a lot more about me, but something that I feel is really important just in dentistry and in the way that I practice dentistry is relationship building. And so that's why I really value things like this, because I think, like Dr. Gray said, what matters most is people, and really seeing people as people and all the things that come along with that. And so I'm just grateful to be here and to have this platform and to talk to all of you.
Wonderful. Thank you so much. Marita, would you like to introduce yourself?
Yes, I'm Marita Engelhardt, and my pronouns are she, her, and hers. I'm a psychologist. I'm not a dentist, but I'm working in dental education since 1990. That's a long time. It also dates my age. I'm a university diversity and social transformation professor at the University of Michigan and a professor of dentistry. And I collaborated on a national survey in 2016 where we asked dental school administrators and dental hygiene program administrators to tell us about their LGBTQ plus related curricula. And then in 2020, and now I work with Scott Schwartz from Cincinnati that many of you might know, on surveys of pediatric dentists, pediatric residents, and general dentists concerning their experiences with education, their professional behavior concerning treating patients from LGBTQ plus backgrounds and patients on puberty blockers. I'm very interested in this. I'm an ally and a mother of 5 children, and 2 of my children identify, one as a bisexual person and the other one as a trans person. And so I'm very interested to be here and very happy to join you here.
Thank you so much, Marita. And I think you've alluded to where we can maybe start today, which is for the panelists. How would you describe the cultural awareness and support of LGBTQ plus faculty and students in dental education from your experience? And if it's okay, I think we'll just go in reverse order, since Marita, you sort of alluded to some of that already. So we'll start with you.
Okay, so a quarter century ago in 1994, we had the fortune of some very visionary leaders at the dental school in Ann Arbor who asked to do a cultural audit, a climate study. And it was absolutely eye-opening to me at that time that when we did these surveys and then follow-up focus groups, that the persons from LGB background, at that time we didn't even have a T or a Q yet, a quarter of a century ago, but they were the student, staff, and faculty that were describing things that were most shocking, I would say, to all of us. And so at that point, we started to do 3 things. And we are continuing this all the time. The first one was that we started community building. We have an alliance. Sorry, I have a cold. We have a wonderful Alliance for Inclusion today at 5:30. We have a get together at one person's house. So we try very hard to have a supportive community. The second thing is that we started right away to change the curriculum. And I teach the dental and dental hygiene students as a behavioral scientist about LGBTQ plus content. We also offer CE courses for our free CE courses for our staff and faculty on a regular basis. Once a year, we have an ally training that's provided from the University of Michigan, from the Spectrum Center that we have here. And we also started this year, with the help of Scott and one of our students, to have the first 3-hour regular CE course. And I can tell you that we had so far over 200 attendants. But we also try to do research, and that is some of the things that I think is crucial to help people understand where we are in our curricula in dental schools, in dental hygiene programs, and where we are in dental offices around the country. And so I think I can tell you a little bit more about what we find in those surveys, but I think it's very important that we advocate in our research publications and make sure that we make sure people know more about what's going on.
Thank you, Marita. Dan, how would you add to that question about cultural awareness and support of LGBTQIA faculty and students in dental education?
Yeah, as I mentioned before, I'm a recent graduate, so I, very recently came out of school. I think in terms of strict curriculum, again, I can only truly speak about my school, but I don't think that my school is an outlier. I think my school is a representation of how it is across the country. And in a lot of respects, probably further ahead than some schools in the country. And I think we had maybe one lecture that was strictly devoted to topics related to LGBTQ things. I think maybe one other lecture came out of the medical school because the dental students at our school would sit in on medical school lectures at times. And so I think in terms of strict curriculum, there's not very much. And I think that's an important thing to address. I think in terms of just the overall environment, I feel pretty fortunate in that when I first arrived at my school, there was no LGBTQ group. And I, with a classmate, decided to try and change that. So we started a group, and I feel very strongly that that group wouldn't have been successful or even been able to do anything that we did if we didn't have the support from faculty and staff and other students at the school. So I think having a group, having a platform, I think all of that helps with sort of the cultural awareness. But I feel like something that is really important is that I think sometimes we get stuck in this place of like, we want people to know about these things, like we want people to know these people exist, and like we want to be politically correct and like not offend people. But I feel like sometimes our goal is short of the things that really matter, like, you know, safety, dignity, and belonging. So I feel like when we ask ourselves these questions, it's important to ask, like, do people actually feel safe? Do they feel like they belong? Do they feel like they have inherent dignity when they're in these places? Or are we just kind of shooting for, oh, like, let's make sure there's not transphobic or homophobic comments being made in lectures or like in behind closed doors? Obviously that's important, but I feel like that's a starting point, and our goal should be much further down the line. But that's my not so short answer to that question.
Wonderful. Thank you for adding that perspective. Scott, how would you describe the cultural awareness for faculty and staff in dental education?
No, I'll throughout the morning here, I'll reference the pilot project I did with my colleague where we took a group of dental students and medical students and had them go through multiple mini interviews, basically different scenarios with a calibrated evaluator that explored different topics within the LGBTQ plus health world, if you will. And what was interesting to me is that the students we talked to, now of course they self-selected and things like that. So there's some biases with the pilot project, but nonetheless, the students all said, yeah, we feel comfortable with this population, but we don't know why we have to. And I know there were also students in there that identified as gay and trans and other things, but they also kind of said, but why does it matter for health purposes? And that's the interesting question, I think, that when we talk about support for faculty and students is, why should we be talking about these things? Why does it matter that you know someone's pronouns? Why does it matter that you know someone's sexual orientation? And I'll be honest, I don't know if I have the best answer for that. But what I do know what matters, and I put this in my bio, is visibility. It's important that there is awareness of a community that has, in a sense, and as a gay man, I feel comfortable saying this, is an invisible identity, is one that often doesn't come out, no pun intended. I did not plan that, until one comes out, and it's one of those things that we have to. I don't think there needs to be a reason to make it relevant other than from the standpoint of like, oh, well, if you're gay, that doesn't affect your health. That aside, yes, it does. But from the student perspective, they might not think it affects your health. It matters because as healthcare providers, we care about the whole person. We should care about the whole person. So in the educational, in the world that I work in at AT Still University, I vividly remember how visibility made a difference, because I had a patient who made some very concerning comments about lesbian women. And I went to my faculty that had a safe zone badge on. And because I knew, and safe zone was for anyone, it wasn't just for the LGBTQ plus community, it was for anyone that needs a faculty to talk to. And so like the moment I became faculty, I was like, how do I sign up for that? How do I become a Safe Zone ally? I've got a little Lego rainbow set in my office because I love Legos, but it's the Everyone is Awesome Lego set. I have that in my office that people can see. I don't think it's necessary for me to be, hi, I'm Scott, I'm the gay professor at AT Still. Like, that's not the way I introduce myself, but having that visibility is so important. And I don't know where that doesn't exist in the world of dental education. And what I mean by that is I don't know what universities aren't doing that. But I can only imagine where there's a lack of visibility, there's a serious lack of support. And even just diversity statements, non-discrimination statements, things like that. Those are simple things I think that can be done, but it does go to a deeper level. I think exactly what Dan is saying, you know, we have to move beyond just the language that you use. And Dan, I hope I summarized that accurately in just a couple words there, but yeah, it's visibility, it's language, it's mission statements, diversity statements. I've been very lucky. I recognize that I have a lot of privilege as a white cisgender male. And I hope that, how do I want to say this? I want everyone to, so I'm struggling with my words. This is a tough topic. I apologize. I cannot find the right words here.
I'm wondering if you're alluding to spending your privilege when you're in places and positions. I'm wondering if that's an area we can talk about next as, you know, LGBTQ plus inclusive spaces. When you do have positions of privilege, how you're able to extend that. Is that something you might feel comfortable talking about?
I think that, yes, thank you, Annalise. It's interesting because I know when I sit at a table and we're talking diversity, I represent the gay male experience. But I think it's also, there's a lot I don't represent. And I think what's really important is that in order to have an environment of support, one can't come to me and say, Scott, tell me about the transgender, the non-binary experience. And I'm like, I appreciate that someone has those questions, but just because we lump all the letters together doesn't mean I understand the experience of my cohort, if you will. And so I think it's important that we recognize that we can't, it's not just having the token gay person. It's not just about having that one person. If we're really going to do this, I will stand up and say, look at what we're missing. And I think that's how each of us can use our individual voices and help and say, I'm not the person to answer those questions. Let's see what we're missing. Let's make sure we bring that together. And I think that's a place where I can use my position within the university. I don't know if all universities have that person. I apologize. I'm never one to get caught up on my words, but thank you for the comments of support too. I appreciate it.
Scott, I think you're really highlighting something important. And Dan, I'm interested in hearing your feedback about, and you kind of brought this up in your initial comments too, about authentic representation. And Scott's really kind of alluding to how with LGBTQ plus communities, like a lot of other communities, it could be seen as tokenizing or really not creating that inclusion and belonging. And Dan, do you have any sort of reflections or reactions to Scott's words?
Yeah, I had a lot of things going. First of all, Scott, I just want to say it's very refreshing to hear privilege be acknowledged. I feel like I think that's so important. And one thing I was really thinking about was I don't think a lot of people know that I think Marita said earlier that like back in the day it was LGB and we didn't even have the T. And want to clarify, and I don't think Marita was saying this, but that like trans people have existed for centuries like this. I think a lot of people I've like heard before, like, oh, it's a fad, like people are really, you know, like, oh, gender, this whole thing. And I'm like, you know, even back in the Philippines in like centuries ago, there were people who were a third gender, and in a lot of these other cultures, these people were actually revered as like sacred, as healers, as like all these things in the community. And so I really want people on this webinar to, like, you can even go and read about this and really just let that like marinate in your mind, that this isn't like something that people invented like 10 years ago to be cool. This is like, for a lot of us, this is in some ways like us, like feeling more in touch with like the place we come from and like our ancestors, and like these things that were pretty much wiped out by like colonization. And so it's not a new thing that has existed. But I also wanted to say that because in a lot of ways the T was added not because we're all the same, but because for political reasons we kind of needed to band together to like be able to fight for rights. But I think in a lot of spaces when we're trying to have like visibility, like Scott was talking about, and representation, a lot of people maybe fall into the trap that, oh, we have a gay person, so that means the whole community is represented. Or you know, I even want to talk about the fact that I think intersectionality for me is going to come up a lot. And the fact that if we want to even begin the conversation about things being more inclusive or accessible for people from this community, we also have to look at how their different identities play into that, right? So like a place can be inclusive for a white cis gay person, but maybe not inclusive for a Black trans woman, right? And that is a very important distinction to make. That's a very important conversation that continues to need to be had if we're really going to talk about how we can make environments better and like more inclusive and accessible for people. Yeah. Those are some of my thoughts that were swirling.
Yeah, that was beautiful. And I'm going to link that into a question that I'll hand back to Marita, because if you signed up for this workshop, you were asked a question about what you were most interested in. And we received a lot of comments talking about recruiting and retaining LGBTQ plus faculty. And it's kind of talking about, to Scott and Dan's point, really creating an inclusive culture. So how are we able to do that, and how are we able to maintain that? And Marita, I'm wondering if you can start us off here talking about ways that we may be thinking about both recruiting and retaining LGBTQ plus faculty, and how we can maintain those environments that keep everybody intersectional and feeling like they are belonging and valued.
Yeah, but I have really a big desire to respond to Dan because there's no doubt that we were very ignorant in 1994. But right now there is a fantastic book, and I only know the first name because Steph wrote it. And they wrote a book about trans medicine that's out in New York University Press. And if you know that book, you know that he describes the 1920s in the US, the 1950s, where people were separated from their children if they were trans, things like that. And so there is a very long and very serious history, and we are just now finding the publications to understand that. And I have to tell you, in 1994, there was a lot of ignorance around here. But getting to your question about the recruiting and retaining of LGBTQ faculty, I think the first thing is we have to start with the students. We have to make sure that people like Dan have an experience in dental school and then in residency programs potentially that makes them embrace the idea that being a dental educator can make a lot of changes. Second, when we do recruiting, I think it's absolutely crucial to make connections between the persons we want to recruit and their peers in our dental schools. And there are people in every dental school. And I hope that we are able to provide that connection for anybody who is in the recruitment process. And finally, when we are talking about retaining, it's absolutely crucial that we build social networks, not only in our school, but across schools, and that we make sure that everybody has a home and everybody has a family they belong to. And I think this caucusing is extremely important. And I hope that allies can be crucial in this whole process.
Thanks, Marita. I agree. Scott, how are you, what would you say in terms of recruiting and retaining LGBTQIA plus faculty? I know you also work at a dental school.
I can say one of the most uncomfortable situations I've ever had from a recruitment standpoint was a residency, but it was at a dental school. First, I was asked in the interview if I was married, inappropriate to start off. But then the next assumption was that my spouse was a woman. And the follow-up question was, if when you talk to your wife, and here I am thinking, I want to go to this program, but they're already making assumptions. They're already asking inappropriate questions. And I am so uncomfortable. Whereas other residencies, you know, it was on my terms. I remember saying I have a boyfriend in an interview, and because I kind of wanted to test them. I wanted to see how they would respond. At this other interview, I just kind of went past it, and I hate that. I hate having to go back into the closet. It's one of the most disgusting feelings ever. So from a recruitment standpoint, language matters. I think, you know, people are uncomfortable with the idea that we're changing language. Well, guess what, folks? Language changes throughout years. We don't speak like Shakespeare does. And I love that Dan brought up, you know, that transgender people have been around as long as people have been around. It's just that now we're in a place where we have language that helps us identify, helps us understand one another better. And you know, if we talk to our colleagues, don't assume, don't make those assumptions. That can make it more encompassing. Things, you know, once you have the job, once you are in the residency and you want to get to know someone, you want to get to know your new colleague, you know, do you have a spouse? You don't have to say husband or wife. You don't have to make those assumptions. It's little things like that help make that environment more welcoming. In terms of retention, I think it's the ongoing relationships that get developed. It's that I know I can go to my supervisor and explain what's going on at home. I can say, you know, my husband's sick this week. I need to stay home and be there with him. And that I know that if my heterosexual colleague said the same thing, there would be no difference in treatment. And obviously that takes a mature person to be able to treat people the same way, but it's also being open when things aren't being done the same way. So that if my supervisor does make a mistake, I can say, hey, this mistake was made. So open communication, I think, is important for retention. That faculty know they can go to their supervisor, they can go to their HR, they can go to whoever the person may be and say, I've got a problem, I would like to address it. If I felt like I couldn't go to people at my university, I don't think I'd be here.
That's critical. Dan, how would you respond to that question about recruitment and retaining?
I would say, you know, I think it's, you know, there's no easy answer to that, right? There's no like recipe for you put all these things in and it's going to be magic formula. I think one thing that is really on my mind, I think, especially with what is gladly a conversation I feel like we're having more in the space of like anti-racism and things like that, is optical allyship. I think for anyone who's never heard that term, it's basically like being an ally because it looks good, or being an ally that just looks good and not actually making the changes like at the root of things to make it better or to make the environment that you're actually wanting. And I think that's what I would say is probably the biggest thing. I think for a lot of these things, yeah, and I think it's probably also sort of an American thing that like we want like the easy way out, right? Like we want like the magic bullet. We want just something like this will fix the problem. And I think the hard answer is that a lot of this stuff is rooted really deep in like our institutions and our educational system. And if we're ever going to make real change, like we need people who are willing to be brave, who are willing to do the things and make the really hard calls that a lot of people might not agree with. I don't think any significant changes that have ever been made throughout history were like super popular opinion. I think there's like some quote that I don't remember who said it, but you know, like it takes a small group of people who are like brave enough to do something to really make change. And I think that's true when it comes to anti-racism. I think it's true when it comes to, you know, being inclusive of trans people, of queer people, of gay people. I think you need people who just really actually care about making the changes and doing the hard things and not just about it looking good, right? Like, well, we haven't heard that people are being homophobic, so things must be good, right? Like, you have to have people who actually care, who like actually care to hear the really hard things to hear and do the hard things and be okay with the fact that that might not be a popular thing and do it anyways. And I think that's like the hard answer to how I think we can recruit and retain these faculty.
Yeah, and Dan, you're really hearkening back to authentic investments in LGBTQ plus people. This isn't about changing your university's logo to pride colors during the month of June. This is about really deepening an institutional investment and what's going to promote inclusion. And I think to everyone's point here, that the LGBTQ plus community is not a monolith. You know, that there are ways to be inclusive based on the individual needs and representation of the entire community and the vibrancy within the community. And I'd like to revisit some things that Scott was talking about earlier around patient care and how being able to provide good educational opportunities. So I think there's one layer of this, wanting to ensure that there's inclusion, true inclusion, authentic inclusion within the dental education environment. And then also when that happens or when that doesn't happen, how does that translate into patient care for LGBTQ plus people whenever you leave the dental education setting? So Dan, I'll start with you on this one, just thinking about how to treat whole person health and how to, you know, provide dental care in an inclusive way. Our dental education environment setting us up for success there, or what are ways that we can, you know, maybe do better?
Yeah, I know Scott earlier said that when he did the pilot study that a lot of students were kind of wondering why it's important. That's also something that I have heard numerous times. And it kind of made me think about the fact that maybe in dental education, we're not doing a good enough job of not only talking about this community, but about talking about the whole person and why it's so important. You know, I think there's numerous identities that people hold that affect the way they're able to access care. I think something we really don't talk about a lot in dentistry is ability. I also think we don't talk about people's experiences, about you know, trauma that they've either had outside of our offices or in our offices. I think these are things that people bring in with them, and sort of like Scott said earlier, a lot of these things are invisible, you know. I know that when I'm practicing dentistry, like my assistants will frequently put things on patients' chests, and that's like a big no for me, because you have no idea what that person's been through. You have no idea if that's a triggering place for them. And I have never once heard that mentioned in a lecture. I've never once heard a professor talk about that. I've heard many professors say, why would you not put it there? It's an extra place to put your tools. And so it's just, I think it's important that we start talking about these things, about, you know, it's not just what your prep looks like, it's all the rest of these things. And I really don't think that we talk about that enough. And I also just wanted to give a personal anecdote about the clinic I work in right now. We serve a large population of people living with HIV and affected by HIV, and also just underserved people, LGBTQ people. And it's really driven home a lot of points to me. A few are that people still think that HIV is like only a queer person's disease, only a gay man's disease. And it's, you know, some of that stuff I also feel like was reinforced in the dental education. You know, it's so common that the only time you hear about a gay person is in the case study where it says this one gay person who has HIV is coming in for care. You know, how are you going to care for them? And you know, it's like there's so much information out there about this, and we're just not talking about it enough. We're not educating our future providers about it. And then I also wanted to say that I have quite a few trans patients who come and see me, and you know, one of them, we were just talking before the appointment, and they were telling me about one of their gender affirming surgeries. So I shared about my gender affirming surgery, and there was just this moment of like light in my patient's eyes of like, oh my gosh, like this has never happened. I don't like someone who maybe understands. And when that person left my office, they were like, I'm going to go bring my fiance to come see you. Like, I got to tell them everything that happened. And I tell that story to say that, you know, it's obviously different. Me being a trans person, that connection is obviously going to be different. But even if you're a cis person, a straight person, if you're able to like make that connection and show that you know about this community and you care about this community, I guarantee that that same person is going to light up in a similar way and go tell their fiance about it, because it's so hard to find people who actually care. That a lot of the times when I talk about this, I'm like, even if we want to put this in like a capitalist view, like how do you have better business? It's like caring will give you better business too, right? And so, yeah, I don't remember what the question was, but those are all my thoughts.
I love that. And I love that you are really hitting home whole person health within oral health, and how LGBTQ plus people are not just about sexual health and well-being, which is sometimes what the community is relegated to, but it's about this entire lived experience. And Marita, what are your thoughts on extending LGBTQ plus inclusion into patient care?
When Dan talked about, you know, we reduce it to HIV when we educate students, that's exactly what we found in 2016. You will be surprised, but 29% of dental schools and 48% of dental hygiene programs did not cover anything, not even one lecture, okay? And the others had usually something about HIV. And this was in 2016, and I would hope that it changes over time. But you're absolutely right. How do we make this, you know, an approach where we see the persons? So that's one thing that I was very, very surprised. Now, we did the survey. There are 4 states that have wonderful publications about how the patients from LGBTQ plus backgrounds describe their experiences. And it's very sad. So Scott Schwartz and I started last year with a survey for pediatric dentists and pediatric residents, and now with general dentists. And it was very interesting because dentists have this saying, I treat all the patients the same. I don't discriminate at all. But just by that saying, they already discriminate, okay? If you have a patient in your chair who has Down syndrome, you're not treating that person the same way as the next person. Every patient in the chair needs to be treated dependent on who they are. And in medicine, we have this fantastic 2011 report from the Institute of Medicine, which is a fantastic compendium of all the risk factors for different diseases and things like that. And so we need to make sure that our students have a similar kind of background in understanding risk factors, suicidal ideation, things like that, that they have to be familiar with. And so one thing that we found in all three surveys is that we ask about patients from LGBT background, then we ask about patients from trans, non-binary, and then we ask about patients on puberty blockers. And there goes the knowledge, and there goes the awareness, and there goes the liking and the comfort level for themselves and what they think with their patients. And so despite the fact that nearly 30% of the pediatric dentists had at least one patient on puberty blockers, but the lack of knowledge, the lack of positive understanding, there's so much we have to do. And then I have to say one thing that I feel very strongly about. So I did surveys for the last 35, 40 years, okay? Every year, many surveys. I love surveys. This was the first one with a general dentist, this LGBTQ plus topic, that I got surveys back where a person had written in black marker, "What the hell do you think you're doing?" or "fuck you," okay? And anger in response to a simple survey. How angry are these people when they have a patient in the chair? It frightens me. And so this is something I really have to digest and figure out, you know, what we can do about it, and especially also what we can do for families and how we can advocate at times for patients, especially if there are children, to their parents and to other family members. So there is a lot here in patient care that we have to do, that we have to understand better, and that has to change.
Yeah, I agree. And it sounds like we have a lot of opportunities to improve. It sounds like there are some dedicated areas there's some gaps to fill, which means that we only have up to go. And so I think this is one way that we can continue to build momentum. And as we wrap up the panel discussion today, I'd like to invite each one of you to leave us, you know, if you could just say, here's the one thing that I want you to take away from this discussion, the one action item that you would leave anyone attending the workshop today. What would that be? And Scott, I'll start with you. Just what's your brief sort of call to action to close out the panel?
Students want this. Students want to know what language to use. They're comfortable working with the community, but they're not sure how best to do so. And I know we're still exploring how best that is. I can promise you it's not a lecture. You can't say, here's a gay person, here's everything you need to know. But now is the time. So while I can't say there's a specific action, I will put out there that students want to know this, and we've got to continue moving the needle on it.
Wonderful. Marita, what would be your brief call to action to close out the panel today?
Yeah. So the Human Rights Campaign documented in May 2021 250 anti-LGBTQ plus bills that had been introduced into state legislators. At least 35 would prohibit transgender youth from being able to access medical care, age-appropriate, gender-affirming medical care. 69 bills would prohibit them from participating in sports, and so on and so on. We are in a war. And we all have to make sure that we are politically engaged, that we advocate, and that we educate each other and ourselves as much as we can, including our students, our staff, and our faculty. Education, education, education. I believe in the power of education.
Thank you, Marita. And Dan, what would you leave us with as the call to action today?
I think the biggest thing I would say is don't let this be the one engagement that you have with this topic. I think this is sort of, my hope is that this is like the starting point, like the spark that lights the fire for everyone on in this conversation, in this webinar here. I would say there's so much information out there. Don't wait to like meet a queer person or meet a trans person and only get information from them and have them educate you. Try to educate yourself about this, because there's just so much information out there. I would say also to engage not just with, like educational sources about this. I would say read from people who are also interested in Black liberation and dismantling white supremacy, because all of these things are tied together. And so opening that topic for yourself is something that's hopefully will light a fire in you about making a change here. And to Marita's point, we are in a war. And I think what people need to understand is if you don't pick a side here, you're picking the side of the oppressor, because those of us that are oppressed are fighting as hard as we can, but we are the minority. And that's why we need people from the majority on that side who are willing to put in the work to make these changes. And yeah, like I said, being passive is basically choosing a side. And so I think all of us on this panel would probably just ask people to be active allies, active participants. And yeah, that's what I would leave people.
I love that. That's a wonderful way to end the panel today. So thank you all for sharing your experiences. I know I learned a lot. And we are now going to move into our informal discussion via our breakout rooms. And so we just have 3 questions here. Again, your facilitators will help you through these questions just to kind of get the ball rolling. But our 3 questions for today are, did anything surprise you? What stood out as a practice you want to incorporate or change? Or what resources do you want to take back for use? So now you should receive an invitation to join a breakout room, and we'll come back together for the last couple of minutes just to say thank you to everybody and share the continuing education link. All right, well, thank you everyone for attending today. Thank you again to our panel. This was such an incredibly informative experience. Hopefully it was a little bit transformative too. And so we just wanted to leave everybody with the link to the CE survey. And I also want to leave everyone with a couple of resources developed by AIDPH and partners with Open, Community Catalyst, and Families USA. One of them is how to support LGBTQIA plus people right now, and a list of very easy best practices that you can incorporate right now as you're looking to be more inclusive within the LGBTQ plus community and oral health. So that's one. The second is the Equality Act Toolkit for the oral health community. Again, developed in partnership with Community Catalyst and Families USA and Open. And these are some ways that you can engage on the policy level, as Marita called us to earlier today, and really engaging meaningfully in the policy process. And so hopefully those resources are helpful. Other than that, I just want to give everybody a thank you. Thank you to our facilitators for helping support discussion in our breakout rooms. And we hope you'll stay tuned for future CE opportunities. Thank you again and take care.